Feel good. Today's Sunny 95.
Welcome to The Reasons We Smile with Dr. Kvitko, the show that brings you man-on-the-street interviews, celebrity guests, groundbreaking research, and heartwarming stories about the reasons we smile. Our show is also known as everything you've always wanted to know about dentistry, but were too numb to ask. Hello, I'm General Dentist Dr. Kvitko, and thank you for joining me today.
The following views and opinions do not necessarily reflect those of this station, its staff, management, or parent company. To hear a replay of this show or one of the great shows that previously aired, log on to thereasonswesmile.com or iTunes, keyword Dr. Kvitko or The Reasons We Smile. Listeners should not use Dr. Kvitko's comments and advice in place of an actual dental exam.
Brighten your life with a smile that shows the professional touch of Dr. Kvitko.
Time now for The Reasons We Smile with Dr. Kvitko. Call 459-9769 to discuss your dental issues. Now, here's your host, Dr. Kvitko.
Hello, everyone. Welcome to The Reasons We Smile. I'm Dr. Kvitko. This is episode number 599. It's July 7th. Thank you so much for joining me. Today's show is in honor of Independence Day. We're going to bring you how to gain your independence from dental disease and other dental issues. And we'll find out if you can gain your independence from your dentist, okay? All right, before we get started, let me remind you, if you'd like to follow me on Twitter, it's at Dr. Kvitko. And if you'd please go to my office Facebook page and like us, that would be awesome. All past episodes, complete with video, are available at thereasonswesmile.com, and we're streaming live on Facebook. Okay, I want to remind you that in about 10 minutes, you're going to have a chance to win free flowers from DeSantis Florist. They'll be delivered to your place of business this Tuesday afternoon, and all you have to do is pay attention just a little bit. We try to make the questions easy, the answer is easy to the question, so that you can win those flowers. Okay, we know it's early, your brain's not working right, maybe you haven't had your first cup of coffee, or maybe you haven't even brushed your teeth yet. Okay, but you can call in. If you want to pre-program the number into your phone, it's 614-459-9769. Okay, so like I mentioned, in honor of Independence Day, and by the way, we gained our independence from Britain, right? So let's start with freedom from British teeth. Everybody knows what that is, right? Crooked, yellow, crappy teeth. Now, they are changing a little bit over there, but for the most part, we still see a lot of British teeth. And in this country, we have had the forethought to straighten those teeth and to whiten them and to make sure they're healthy. So if you want to gain your independence from British teeth, you can start by straightening them. Now, we're talking about independence from some of these issues. You can't really straighten your teeth yourself. There are a lot of those. I've gone on YouTube and seen these videos where somebody takes a little rubber band and shoves it between their two front teeth to close the gap. But what they don't realize is they're just going to open up a gap on the other side of those teeth. So it's really hard to do it yourself, folks. Also, I came upon my first patient who had gone and used that thing you see on TV. I don't know, it's called, I forget what it's called now. Basically, it's direct to you. We're going to send you these aligners right to your door. You'll never have to see a dentist. And what's it called? It's like Invisalign, but it's, I forgot what it's called. It might come to me. Anyway, it was funny because she was in my chair, and I asked her if she ever thought about getting her teeth straightened, because she's a young girl, a pretty girl, and she has healthy teeth, and that's a perfect example of somebody who should have straight teeth, is when they're perfectly healthy, right? There's nothing else wrong. You don't have to worry about gum disease or loose teeth, all that. She goes, "Oh, I just did it." And I'm like, "You just did it?" She goes, "Yeah, I did it with whatever brand, I can't remember." And I'm like, boy, if I'd have done that and it had wound up like that, you would not have been happy. I think I even told her that. She goes, "Well, they moved a little bit and I'm fine." So I don't know what it costs, but and I don't know. I don't think friends and family, maybe family, but I don't think people you meet are going to look at you and go, "Wow, she's got crooked teeth, but I bet they used to be worse." So they must be okay now. They're still crooked. So anyway, we do 6-month smiles at the office, and obviously there are orthodontists around. So freedom from British teeth would start with straightening them. All right, now freedom from I want to make sure I'm going to cover all of the ones. Okay, freedom from chipping teeth. So if you want to have freedom from chipping your teeth, you need to be careful not to abuse them. Don't open ketchup packets with your teeth, right? Don't bite your nails with your teeth. And something else you can do is wear an appliance called a bruxism appliance. Now that requires a dentist. We do an impression of your mouth, and we make it so that when you put it in your mouth, all of the teeth touch at the same time, so it deprograms the muscles so you can close without causing strain on your TMJ. And if you wear that during the evening, and by the way, anyone who's had a smile makeover where there are a lot of porcelain veneers or crowns, it's recommended that you wear this. So basically, let's say you sleep 8 hours a day. Well, you're taking out of the equation the chance that you could chip a tooth by a third, right? 1/3 of the day. All right, so that would be to avoid or have your independence from chipped teeth. Now, the next one I want to make sure I cover would be acid erosion of your teeth. So I don't know if a lot of people even realize they have this. People that are bulimic, they know because they've seen it. Their dentist has pointed it out. But essentially what it is the very severe stomach acid that comes up when a person throws up. And we've all thrown up, so we all know what we're talking about, but a bulimic does it on purpose and gets that acid on their teeth more often. Anyway, if you can avoid that, so first of all, you want to avoid throwing up as much as possible, so avoid whatever makes you throw up. If it's bulimia, obviously maybe try to get some help, but sometimes people just have this esophageal reflux. You can see your physician and be prescribed some medications to prevent that. But the other thing that happens that causes acid erosion is what we drink. So if we drink Mountain Dew, we drink just regular fruit juices. I'm talking about apple juice, orange juice, even tomato juice, that's an acidic juice. And lemonade, all of those have acid in them. Any soda pop has acid in it. And so what you want to do is after you've had a drink of something acidic, which is the things I just mentioned, you want to follow it with a glass of water. Rinse out your mouth and get that acid out of there, get the pH back to normal, and that can avoid the erosion that happens from acid. Okay, so to have your independence from acid-eroded teeth, you need to do that. Okay, now, some people their dentures get loose. And when your dentures get loose, they rub. And when they rub, you get denture sore spots. You're not supposed to have denture sore spots because you're not supposed to wear your dentures long enough to have them become loose. Dentures are supposed to be relined at least every 2.5 years. Now a reline is more than you think. A reline isn't just putting a lining in there like you would buy at the grocery store or the drugstore. I mean, we see these. I think the one I'm thinking of is called C-Bond, right? And it shows you're going to put that little wafer of whatever, something sticky in there, and they're going to stay in. Well, that's true to a point, but that's not a reline. A reline is where we dentists do an impression of, we use your denture as an impression tray. We put an adhesive on that inside layer, and then we put impression material in that, and then we put it in your mouth. And then while it's in your mouth, that impression material takes up the space between the plastic of your denture now and the way your ridge is now. Keep in mind that the plastic was designed back years ago before your gums and bone had a chance to shrink. So there's actually a little bit of airspace under there, which is why you could put that C-Bond stuff in. Okay, so when we put our impression material in, we're actually taking that space. We're taking up the space. We're making the tissue side match up with the acrylic side, but that's just the beginning. So we take that impression, we send it to the lab, and what they do is they put that down into a plaster mold, and it's designed. And what happens then is they put that on one side of the mold, and then so the teeth side is on one half of the mold, the tissue side is on the other half of the mold, and then it's heated. Put in hot water, it's heated, and then they open up the mold and they peel out all of that impression material, which is softened by the heat. And so now basically you have a space in there where the airspace used to be. And so what the lab does is they will grind away a good maybe 3-4 millimeters of the acrylic that you currently had on your denture. So that whole surface that used to touch your gums, that all gets ground away. And then they'll put denture acrylic, mix it up. It's like a little, it's a polymer, and a powder, and they mix it up. It's like a little dough, and it goes into that mold, and then they put the two halves back together, and that you have literally, it's like a new denture on the tissue side. The only thing that's not different is the teeth. So, which is why when we talked about if you want to have your independence from sore spots and loose dentures, you have to get them replaced periodically. The rule of thumb is every 2.5 years you might need a reline. Not everybody, but a lot. And every 5 years you most likely need a new one. Okay. And because the teeth wear out, so even if it fits, if your teeth have worn down to where they're just flat, they're not really chewing, well, now you're chewing your food like a cow, like chewing your cud, like back and forth, like big motions, you know. If you get new teeth that line up and work like gears, well, they chew better, and you'll be able to eat more foods, not as much labor-intensive function to do it, and you'll have everything will be lined up. The way you chew, the way you smile, the way you bite, you know, all of that, and there's no looseness and therefore no more denture sore spots. Okay, so we covered 3 on purpose because they are going to be Dr. Kvitko's question of the day. I'll just refresh your memory. Avoiding chipping teeth by wearing a night guard. Avoiding acid erosion of your enamel and dentin by drinking water after acidic liquids or foods. Or if you're bulimic, rinse out with water afterwards. Or if you have esophageal reflux, you know, that sort of thing. And then another one was avoiding these denture sore spots by having your dentures relined or replaced regularly. Okay, and by the way, if you're one of those folks where you have very little ridge, these days we can put implants in and make it so that you can still wear a denture. Okay, so let's do a couple more before we do Dr. Kvitko's question of the day. Broken teeth. So how can you gain independence from broken teeth? Now, one of the obvious things would be to wear a mouth guard, to wear an athletic mouth guard when you're involved in sporting activities. The problem is, you know, with children, you'd almost have to wrap them in bubble wrap because it's not just when they're doing sports, it's when they're riding their bike, when they're playing outside, you know, playing tag, even hide and go seek. They can jump up and, you know, accidentally run into a corner of a wall. So some of it isn't preventable, but you can at least talk to your children. You can make sure they have a custom-fitted mouth guard for any sports injuries. I don't know if you can put bubble wrap on the corners of your walls or not, but I do know that we baby-proof our homes when there's a toddler who can open up cupboards and drawers, right? So anyway, that one's a little bit of a challenge, but definitely something to keep in mind. I'm not saying put bubble wrap. I'm just saying just try to teach them to be careful. Okay. Although maybe that'll be some new design element that they can work in, huh? Okay. Now, I think we will. You know what? I think we're going to go ahead and do Dr. Kvitko's question of the day, and we have about 7, 8 more of these. But before we do the contest, we'd like you to listen to this.
This station will not be held liable for any contesting during The Reasons We Smile with Dr. Kvitko. Participation in the contest allows Dr. Kvitko to record and broadcast your name and call. 1 winner per household. Prizes are non-transferable, cannot be substituted, and are subject to taxes and fees. This station cannot be responsible for the inability to enter the contest, whether due to equipment malfunction or telephone difficulties. All decisions of Dr. Kvitko concerning this contest or eligibility are final.
And now it's time for Dr. Kvitko's question of the day.
All right, today we are giving you ways to gain your independence against dental disease and other dental issues. Which of the following are ways you can do so? A, you can avoid chipping teeth by wearing a night guard. B, you can avoid acid erosion of your enamel and dentin by drinking water after anything acidic. C, you can avoid denture sore spots by having your dentures relined or replaced regularly. Or D, all of the above. All right, the winner's going to receive those free flowers from DeSantis Florist. They'll be delivered to your place of business this Tuesday afternoon. The number to call is 614-459-9769. That's 614-459-9769. So go ahead and call now.
You won't believe it though. I wanna hear your mind, and there's nothing else in the world tonight. She said people don't take the time. Hey, people don't take the time.
Hi, I'm Keith Carlos, winner of America's Next Top Model and star of Chocolate City 2. Look for my smile on the big screen this summer, courtesy of Dr. Kvitko. Stay tuned to The Reasons We Smile with Dr. Kvitko, the world's most interesting dentist.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. Did you know that you no longer need to visit several different dental professionals to get more complete dental care? We handle everything from cleanings and orthodontics to restoration, implants, and smile makeovers, all in my office. Get the most advanced technology and procedures available today. It's more complete dentistry.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
Dr. Kvitko! Let's go!
Hi, I'm Johanna, and I've been a dental patient at Dr. Kvitko and Associates for over 10 years. I would really recommend Dr. Kvitko for your family's dental care. They're friendly. They're always there to help me. I feel like family when I walk in the door. It's clean, it's comfortable. Even if I have to bring my kids, they have a great playroom for them. I know when I'm with Dr. Kvitko, they are taking that extra time to make sure that I'm going to be the healthiest I can be. They've been great. I love them.
Call Dr. Kvitko and Associates today, 614-262-9588.
Hi, this is Richard Simmons. Dr. Kvitko's here, and he's going to help you with all of your problems. Are your teeth yellow? He can fix that. Are you missing a tooth? He can put a new one in. How is that?
That's very good. Thank you, Richard. Okay, we're back. We're doing Dr. Kvitko's question of the day. The winner, today's winner, is Jenna. Jenna from Reynoldsburg. All right, so thanks for calling in and getting the answer right, which was D, all of the above. All right. So now, if you're just joining us, I'm Dr. Kvitko. This is The Reasons We Smile. It's episode number 599. Today we're giving you ways that you can gain your independence from dental disease and other dental issues in honor of July 4th, Independence Day. And so the next one on my list is independence from crowns coming off. Okay, crowns come off, right? Now, here's the thing. I would say 99% of the time, somewhere close to that, if your crown came off, it's because your tooth got a cavity underneath. Very rarely, but there are instances where a crown will come off and I'll look at it and it's like clean inside. The tooth is clean. We can sandblast the inside of the tooth, the inside of the crown, clean off your tooth, and just simply re-cement it. But that's really far and few between. More often than not, a crown coming off is because there was decay slowly growing and percolating up underneath there, and you didn't know it, because what do I say all the time? Decay doesn't hurt, so you don't know you have it, and then your crown comes off, and people are very disappointed to find that they can't just have it re-cemented. They oftentimes need a new one. If you catch it early, and the way you catch it early is going to your dentist where we can feel around the edges, and if I find a soft spot, sometimes I can place a little filling, a little patch right around the edge, and if I know I've gotten it all, we're good. I can do that several times. But if it's been long-standing, haven't seen you for a while, haven't x-rayed it in a while, usually can't take the chance and we have to do a new one. But let's talk about tooth decay, because that's also one of the ones that you want to have your freedom from, right? So how do we get tooth decay? We get tooth decay because our teeth are being bombarded with acid and sugar, and we say we brush, and we maybe do brush, but do we really brush thoroughly? Do we get every little piece of food off? Do we get every little piece of whatever? I mean, how many times have you brushed your teeth in the morning and something comes out and it's like, what's that? Oh, that's a sesame seed from the sandwich I had last night. So it was in your mouth the entire night, and the bacteria were using it as a food supply and what happens when bacteria thrive in our mouth? They give off acid, and it's that acid that causes the decay. So a very thorough brushing, very thoroughly cleaning your mouth and teeth after every meal, and making sure that you, rinse with water whenever possible. That's how you avoid tooth decay. Now, avoiding things like crowns, you do that by getting the cavities discovered early so that they're fillings, not crowns. Okay, so a little tiny filling is no big deal. It's not very expensive. With the laser that I have, we don't even have to numb people using a needle very often anymore. The laser numbs the tooth. And so we can fix these things when they're small, and then you never have to be one of those people that says my crown came off, or you never have to be one of those people that says I have a cavity. But the only way you're going to know, though, is to have us check. Okay? So let's talk about independence from bleeding gums because it's related. So why do gums bleed? They bleed because there's something on your teeth, and that irritates your gums. They don't like it, and so your body says, hey, I don't like this, let's try to get rid of it, let's grow some new plumbing. That would be capillaries. So when your body grows new capillaries in an attempt to carry away the material that you didn't brush off or floss off, that means there's more blood supply there, and it means your gums bleed. So it's a sign to you that your body's saying, hey, you got to take better care of us in here. Because if you don't, we're going to move to a new neighborhood, and what that causes is gum disease, gingivitis. In fact, the definition of bleeding gums or inflamed gums is gingivitis. And then if those tissues, if you don't clean them off soon enough, you don't clean off the teeth soon enough, well, those tissues kind of migrate away from the source of the irritant, and that becomes periodontal disease, which means there's also bone being lost. So the only way to have your independence from bleeding gums, gum disease, and periodontal disease is to have super, super clean teeth all of the time. All of the time. Now, has anybody ever done like I do, which is you drive all night to go somewhere? I just like driving through the night. So I'm awake the entire night, and yet sun comes up, I can feel the fuzzy sweater feeling on my teeth. It's like, when did they get in there? When did that happen? I was awake the whole time. How'd they sneak in? We're used to waking up in the morning with that gunky feeling on our teeth, but when you're awake, how'd that happen? It always surprises me that it's there, and it's like I don't notice it happening, but sure enough, it's there. Okay, so if you're just joining us, I'm Dr. Kvitko. What we're doing is we're bringing you ways to gain your independence from dental disease and other dental issues, and I think we're going to go to a break right now. We have 1, 2, 3, 4, 5, 6 more to go, and we'll be right back.
You can't take me as I am, not just a little bit. I don't know who to be. I'm a paper cup, baby, of the sea. I know you see it too, 'cause you're too much for me.
This is Clark Kellogg. Stay tuned for more of Dr. Kvitko.
Estás escuchando con Dr. Kvitko aquí en su estación favorita.
Hi, I'm Dominique Reichert. Like what you hear? Why not use the show to promote your product or service by becoming a sponsor? Call 614-262-9588 to learn how. That's 614-262-9588. Call now.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. I've been honored to help several famous people get a perfect smile, like Keith Carlos and Dominique Reigart from America's Next Top Model, and Ted the Golden Voice Williams from right here in Columbus. Isn't it time you had a celebrity smile? It costs less than you might think, and most of the time, it can be done in one visit. A new smile can make a world of difference.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
I'm Grandpa, and I go to Dr. Kvitko, and I still have all my teeth. Real ones. Where's my glasses?
Okay, we're back. We're talking about ways of gaining your independence from dental disease and other dental issues, and we are up to toothache. Who hasn't had a toothache? And isn't it the worst? It's the worst thing you can have. Everybody that has these terrible toothaches tell me it's worse than childbirth. It's worse than an injury they got at work. And somebody once said, and I don't know if there's any truth to this, but there might be some. It says because your teeth are halfway between your heart and your brain, they hurt the worst. Like maybe worse than a toe. I don't know. I don't think that's really supposed to be true, but certainly you can understand why somebody would think that. So toothaches won't happen. You'll be independent of toothaches if you don't let yourself get cavities. If you don't let yourself get cavities. And you don't bump your teeth. So like if a tooth absorbs a blow, maybe even accidental, you get punched in the tooth and you didn't knock the tooth out or break it, well that blow can cause the nerve center where the blood vessels are to swell and cut off its own blood supply and die, and then you get this terrible toothache, which means you have a tooth abscess and you need a root canal. But so undiagnosed tooth decay or some kind of a blow, if you can avoid getting tooth decay like we talked, and if you can avoid having a blow to your teeth, that would you would be independent of toothaches. Now jaw ache. Jaw aches come from impacted wisdom teeth. They come from tooth abscesses, like I just mentioned. And then they come from temporomandibular joint disease or syndrome. And so you can avoid that by not, some of these people are incessant gum chewers, and you continually chew, and it seems to me like you're wearing out the jaw joint, so try not to overuse it if you can help it. And if you have impacted wisdom teeth that need to come out, have them out, because it's really painful when you wait until you need them out. I'm not going to say it's not unpleasant when you get them out, but at least for that instance, we give you some medication and something to get through it, and it's going to be gone in a couple, 3 days, the pain I mean. So another would be cold and hot sensitivity. This is caused by what are called cervical abrasions, where you brush incorrectly and you literally carve the side of the tooth away, and also a phenomenon called abfractions. And abfractions happen when your bite is off a little bit and you grind your teeth and the teeth move and kind of flex. Well, enamel doesn't flex, it's glass. So the little shards of glass break off, and then you get this hollowed out spot on the side of your tooth, So trying to avoid that, and of course you can go back to that night guard we mentioned, would help prevent that. Okay, and then and also when you get the cold sensitivity or hot sensitivity, it's when you've had gum recession, when the part of the root's exposed over there. So the way you avoid gum recession is to make sure that you are properly brushing, so you're not going to carve away the gum, and that you're keeping your gums and teeth healthy so that they don't want to resorb, they don't want to move down, okay? Recede. Another one, hot sensitivity is the same as cold. Another is just plain old pain. Pain is a conglomeration of everything we've talked about, but usually neglect, okay? I mean, we're not designed to have toothaches, to be honest. And by the time we get one, it's usually too late for that tooth. Our body does not warn us as soon as it probably ought to. It really doesn't. I remember as a child, I put my finger on the hot stove and I was crying, and my mom was trying to console me, and I said, she says, it'll be okay, don't put your finger on the stove. And I go, well, I won't. But why does it have to hurt so bad? She goes, well, it's a lesson to teach you not to put your finger on the stove. And I said, well, I promise not to do it. I'm only like 3 or 4. Why does it have to hurt so bad? But then, as an adult and as a dentist, it struck me that wouldn't it be best if your body warned you when your finger was about an inch away from a hot plate? Wouldn't it be best if it warned us when we had a cavity before it became a root canal, before it became a toothache? It doesn't. But everybody walking around, most of you listening right now, think you're fine because you don't have a toothache. Just about everybody in the room, everybody in their car driving around thinks you're fine because you don't have a toothache. And unless you've had a dentist check it recently, you probably have cavities. You probably have some gum disease. You just don't know it yet because your body doesn't warn you properly. All right, and then swelling. Swelling's another reason. I go to the office oftentimes for emergencies. I was there yesterday morning. Went in on Friday, which we were actually closed, but me and an assistant went in to take care of somebody. And it's what we do, because that's, when I accept the word doctor in front of my name, I want to act that way. I'm not, yes, it's a job, but to me, I take it very seriously. And I'm passionate about what we do. But when somebody comes in, just like, I'm talking golf ball swelling, sometimes even bigger than a golf ball swollen. Wow, that can be dangerous. People die of that. And so we need to figure out what's going on. If it's a tooth, get that tooth out. If it's a tooth that needs a root canal, do the root canal. Heavy-duty antibiotics. Sometimes those things point up on the outside of the face, and we actually wind up draining it through the skin on the outside of the face with a little rubber drain, a little piece of what we call a rubber dam that we numb, of course, but we put it up in the little hole to hold it open so the pus can come out, because the skin wants to close up really quickly, and because it doesn't really like having holes to the outside world. But and of course that can be caused by an impacted third molar. That can be caused by an abscessed tooth, a cavity that's become infected. It can be caused by severe gum disease, to be honest. People that haven't taken care of their mouth, and now they have a periodontal abscess. The tooth was fine, but now the gums were so infected it worked down and killed the tooth, and between the two, you're all swollen. So that has to be dealt with right away, folks, and it can be life-threatening, and it has been life-threatening to a lot of people. So here's the last one. If you want to gain your independence from dental disease and other dental issues, and I mentioned, kind of alluded to, let's find out if you can also gain your independence from the dentist. That would be a big fat no. If you want to have your independence from everything else, you need to see the dentist. It's just true. So, you know, our car gives us a warning when we need to take our engine in for a check, right? Well, your mom gave you a warning, hey, time to go to the dentist, but did you go? No. I'm looking at my producer. Did you go? He's giving me that, not really. So anyway, it's how we stay healthy. We know there's a definite connection between dental disease and our overall health. We know that people that have had myocardial infarctions, strokes, heart attacks, that they find oral bacteria in those atherosclerotic plaques, the things that block your blood supply to the rest of your body. And of course, that's what a stroke is: lack of oxygen to a certain to your brain, and then hopefully you catch it before too much damage has been done. And so people that are walking with those canes have usually had a stroke. It's usually not like a leg injury or something, which was something I didn't realize until in my older years. Okay, folks, I think that's pretty much all we have time for. Do appreciate you tuning in. Hopefully we had fun with the topic and trying to avoid having British teeth, okay? Because our independence from British teeth. All right, that's all the time we have today. Don't forget to follow me on Twitter. It's at Dr. Kvitko. And please go to my office Facebook page and like us. It's Dr. Kvitko and Associates. Remember that all past episodes, complete with video, are available at thereasonswesmile.com. Be sure to tune in next week and every week right here on your favorite station. Goodbye.
This is Carly Red from Love and Hip Hop Atlanta, the hit show on VH1, urging you to tune in next week with my dentist, Dr. Kvitko.
If you're interested in learning more about this and other dental health topics, go to thereasonswesmile.com to access full episodes of Dr. Kvitko's show.
If you'd like Dr. Kvitko, the world's most interesting dentist, to speak at your next event, please call 614-262-9588. That's 614-262-9588, or send an email to speaking@thereasonswesmile.com.